Hi, my name is Kelly McCluskey, and I'm a student in the Master's Applied Behavior Analysis program at Ball State University. This prompting video is for the Special Education 683 course, and it will be used for the purposes of this prompting hierarchy assignment. So I'm going to start off with explaining what a prompt is and why it is useful. So with ABA, we are trying to teach our clients the skills that they need to live as independently as possible. In teaching these skills, therapists will often use prompts. A prompt is something that a therapist or an aide does to help the client learn new skills and be successful in responding with correct answers. There are many different types of prompts that a therapist can use to help a client learn, including verbal instruction prompts, physical prompts, and modeling. The main goal of prompts is to gauge how much assistance that the learner needs to learn the skill that you are trying to teach, then systematically fade or slowly stop providing more intrusive assistance until the learner can eventually perform the skill independently. So prompts are useful because they help the learner learn how to appropriately respond or learn new skills without being too frustrated with the learning process, since these prompts will also be used with an errorless teaching method. So an errorless teaching method means that if the learner responds incorrectly, then the therapist will guide the learner to respond correctly with the most appropriate prompt at the time. So which prompt being used can vary widely, and it depends solely on the client. So if they're at the beginning of a skill, you might use more assistance, or if they've been learning it for a while, you might use less assistance. So what prompt being used and is appropriate for the learner depends on the time and the learner. So when teaching a new skill or how to respond correctly, therapists will often use a chaining system for their prompts. So this means that the therapist will assess how much assistance is needed in the beginning, then systematically fade or slowly stop providing as much assistance until the learner is able to complete the task on their own independently. So the most common prompt chains that can be used are most to least prompting and least to most prompting. So this is a chart showing most to least and least to most. So we have at the top for the most prompt, like most assistance needed, would be full physical. Then it goes to partial physical, model, gestural, verbal, visual, then independent, which is the least amount of prompting using it, and they can do it on their own. So for this video, I'm going to show just one target skill that will be focusing on teaching, which will be how to open a jar of almond butter, and explain or show you how these prompts can be used based on that one skill. So I have my assistant here with me, and he will be helping me show how to perform these prompts. So first on the most to least prompting hierarchy list is full physical. So for full physical prompting, it's performed how it sounds. So for this prompt, you want to guide the client in a way that you're fully physically assisting him or her, meaning that you will be using your hands to guide the learner's hands to perform this skill. So we call it hand over hand. So this is how this skill would look like. So open the jar. Good job. So that's how that full physical looks. So after full physical, on the most to least prompting hierarchy would be partial physical. So for this method, it is kind of similar to full physical, but it uses less physical assistance. So it can be a tap under the elbow, or you can guide from the wrist, but you're not doing hand over hand anymore. So this would be a partial physical prompt. So open the jar. Good job. Okay, so next I'm going to show a modeling prompt, which is the next on the most to least prompting hierarchy after full and partial physical. So in a modeling prompt, the therapist will perform the skill in front of the client so the client can observe how the skill is done. And then once the therapist is done completing the skill, they will ask the learner to perform the skill, or the learner will perform it on their own. So this would be a modeling prompt. Open the jar. Good job. So next we're going to show you what a gestural prompt is. So a gestural prompt can be any kind of gesture that a therapist performs in order to evoke a response from the learner. So it can be a point, it can be a shrug, it can be touching an object. So this would be the example of how to do it while pointing at the lid. So open the jar. Good job. And then this would be a way of doing a gestural prompt with just a motion. So open the jar. Good job. So the next on the prompting hierarchy would be verbal prompt, and that's exactly how it sounds. So it will be the therapist is vocally saying, we're providing a prompt for the client to engage in the skill. So open the jar. Good job. Okay, and then the next on the prompting hierarchy list is a visual prompt. So visual prompts are used like for what the learner can see. So included in this kind of prompting is a textual prompt and positional prompt. So first I'm going to show what a textual prompt looks like, and then I'm going to show what a positional prompt looks like. So for this, I have this textual prompt is open. So I can go open the jar. Good job. And then for a positional prompt, I can do this. Nice. So then after that would be an independent. So that's when the therapist doesn't do any kind of prompting at all. So then the object would be presented and I would not say or do anything. It wouldn't point, it wouldn't motion. I just kind of stay still and the client knows what to do. So you're going to demonstrate an independent prompt. Nice job. And thank you. So that was kind of showing you the order of how most to least prompting would look like. So that was going from the full to the independent. And on the inverse would be, least to most. So that would look the same, but it would be going backwards in the chain. So yeah, that was my prompting hierarchy video, and thank you so much for watching.